We're now going to move really focused on the marketplace on the ACA. So Professor Lavender.
So our first point here is that the Inflation Reduction Act had extended these premium tax credit subsidies so that it was no more than 8.5% of income, and there wasn't that 400% cliff, and people below 100% of the federal poverty, which in non-expansion states had been in this coverage gap, they could now get $0 premium plans, right? And so that's going away. And again, who is it affecting? Kind of that higher income group and then the really low income group. And if more states do decide to drop that expansion group, that coverage gap becomes even more important, right? So even thinking about talking to people about, can you bring your income up to 100% of the federal poverty line to qualify for subsidies? That could be an important, encouraging conversation. It was planned to sunset at the end of this year, even with the last administration, but now that we have a new administration in, it's like almost certainly going to happen, and that's gonna drop a lot of enrollees in the marketplace. 2024, there was record enrollment in marketplace plans, but this is gonna have a major drop, right? And additionally, we could see kind of shifts in terms of plan selection. So if you are no longer eligible for a subsidy, maybe you don't get a gold or silver plan, but you transition to a bronze. And then maybe things like hospital indemnity kind of helps back out, because the marketplace works really well for people who are subsidized, but for people who don't have subsidies, getting good plans on the marketplace is very expensive. So just being aware of kind of those shifts and what consumers might want and those risk pools. We think that healthcare.gov is not going to go away. People are still going to shop for plans there. One of the reasons is that things like navigators are being cut. The Biden administration had like $500 million over the next 5 years for navigators, and Trump in this proposed rule has cut it down to about 10 million. So that's pretty substantial, and that means that brokers are really important in trying to help people navigate all of the many options on the marketplace. Another thing that we're seeing in the proposed rule that came out March 10th, so we'll see if it goes through, but is kind of moving that enrollment window back down to what it used to be of November 1st through December 15th instead of until January 15th. That is shortening, and that's going to mean that the business busy season is condensed. And they kind of gave the explanation of helping more align with ESI plans, and that would kind of improve adverse selection issues. But we know that people with ESI, they can't get subsidized markets plans. So what's going to happen there? Probably not a whole lot, but Medicare and Marketplace are going to be having kind of more of the same busy season. There's also more protections about re-enrolling on income, and if you have a $0 premium plan, you get a $5 premium until you've re-verified your income. So overall, there's a lot of things that are likely to reduce enrollment. CMS, with this new set of proposed rules, said that marketplace enrollment could be 750,000 to 2 million people smaller. It's a very large confidence interval, but kind of reflects all the uncertainty that we're seeing.
Yeah, so this is something we are watching real close. The proposed rule that I heard at this conference, actually, we should hear something around April 11th on what the final rule will be. The enrollment time frame, I think, is one of our biggest concerns, because we as an agency do have agents that sell both Medicare Advantage, which, as we know, that enrollment period is October 15th to December 7th. And then it overlaps here. It looks like you would only have about, 8 days to get into front of your ACA clients to make sure that they're on the best plan. So that's concerning. I don't know that they think that way in Washington of making sure that we're able to help every client in the household as an independent agent. So. Also, the passive renewal piece of that proposed rule is something we're watching. We, as independent agents, we want to touch our clients. So going into Medicare.gov and the account and having the healthcare.gov, sorry, we're on ACA here, going into healthcare.gov and touching the client's profile, that doesn't scare us at all. We're excited about that piece. I think it's the passively enrolled where they get penalized. That $5 is a little nerve-wracking to see people who are on a $0 premium plan. How are they going to afford the $5? And that's going to be automatically applied, or they get kicked out. Is kind of how we're reading that. So that's something we're definitely watching. And then let's see, the navigator, that cut there. We should have a lot of cheering going on. That means that we are seeing independent agents. They're seeing our hard work and what we do. So we don't have to compete against them. We are, in fact, bringing the solutions to the household.
Yeah, I think obviously for us, the biggest concern is the time frame. We're predicting we're going to have a decrease because of that, because agents are trying to sell both around the same time. So that's something that we're definitely watching. But I think in general, just from a policy standpoint, not necessarily directly related to ACA, but the other concern that we talk about a lot is just the increased scrutiny that we're getting. And I think that's across all of the industry. Obviously the proposed changes from was last year or the year before about the broker commission changes, and we're expecting quite a bit on the Medicare Advantage side, so that's definitely got us a little nervous.
And I can't help to think, we've seen a couple of the FFM states go to state exchanges, and you're seeing more of that talk. You just wonder, are other states going to look at going to a state exchange? It's very expensive, so I don't know how they would, get there. But you just wonder, are they going to go to more state-based exchange just to control some of the enrollment periods and things like that? It's just something that kind of sticks in my mind if, the state will go that way.
Yeah, so actually with this change in the enrollment season, I'm pretty sure it affects all of them. Even if they're not the federal, it's a state run, this actually applies to them too, where before states did have more flexibility if they were running their own exchanges.
Yeah, and it seems the overarching theme here is more competition and more pressure, right? More things are going to happen in a shorter period of time. And, Susanna brought up a great point. She's not just competing for the lives, she's competing for the mind share of the agent. If all of these things are overlapped and competing with each other, it seems to me that the health plans and the carriers that make it easy for the agent to write the right policy, they're going to win, because the pressure on those kitchen table agents is going to be tremendous. And this year, especially where we just don't know, there's a lot of uncertainty and a lot of chaos. There's great opportunity in chaos, but there's also great threat. And you sort of don't want to wake up on December 15th and find out that your best producing agents were writing something else because they were distracted,